Today, we are diving deep into one of the most amazing and honestly complicated joints in your body, the knee. We're going to look at its incredible design, what happens when things go wrong, and the paths we can take to fix it.
All right, so here's our game plan. We'll kick things off with the knee's incredible engineering, then take a look at the kneecap's tricky job. After that, we'll get into what happens when things go bad and wrap up with how we recover, both with and without surgery.
So right off the bat, let's just blow up one big misconception. Your knee, it is not just a simple hinge that swings back and forth. No way. It's this beautiful, complex system that rolls, glides, and even locks into place, all while holding you up. It's a true masterpiece.
So let's get into it. The knee has these two massive and kind of contradictory jobs to do. It needs to be super mobile, so you can run, jump, and twist, but at the same time, it has to be incredibly stable to support your entire body's weight when you're just standing around.
And this is where things get really cool. There's this feature called the screw-home mechanism. As you straighten your leg all the way, in those last few degrees, your lower leg bone actually rotates outwards a tiny bit. This movement literally locks the joint, making it super stable so you can stand without using a ton of muscle energy. It's kind of like tightening a lug nut on a wheel to make it solid. Now, your knee doesn't just move one way. It has two main modes of operation, if you will. There's open chain, like when you're kicking a ball. Your foot's just flying through the air. Then there's closed chain, like when you do a squat. Your foot is planted firmly on the ground. In that case, your thigh bone is the one moving. Knowing the difference here is absolutely key for exercise and for rehab. Okay, let's shift gears and talk about the patella. You know, the kneecap. This little bone is a powerhouse of leverage, but it has to follow a very specific path. And when it doesn't, well, that's where a lot of knee pain comes from. You might think the kneecap is just the little bony shield there for protection, but nope. Its main job is to act like a pulley for your quad muscle. By sitting out in front of the joint, it gives the muscle a mechanical advantage, seriously boosting its power and making it way easier to straighten your leg. Now, for that pulley system to work perfectly, the kneecap has to glide in this little groove on your thigh bone. And its alignment is all about something called the Q angle. Imagine your quad muscle is a bowstring pulling on the kneecap. The angle of that pull is the Q angle. When it's in that sweet spot around 10 to 15 degrees, everything tracks beautifully. So, what happens when that perfect alignment gets all thrown off? What could possibly knock that little kneecap off its smooth, happy path? And this, right here, is probably one of the biggest aha moments for a lot of people dealing with knee pain. The problem often isn't actually at the knee. It starts somewhere else. Yeah, a tight IT band on the outside of your leg can pull it sideways. But a huge culprit is weakness in your hip muscles. When those hip muscles aren't doing their job, your whole leg can rotate inward, which yanks the kneecap off track. All right, so we've seen how brilliantly designed the knee is. But what happens when things start to go wrong? Whether it's from a sudden twist or just the slow march of time. Let's talk about the two big ones, osteoarthritis and rheumatoid arthritis. On the surface, they might sound similar, but they are worlds apart. Osteoarthritis, or OA, that's your classic wear and tear. The cartilage just breaks down over the years, often leading to a bow-legged look. Rheumatoid arthritis, RA, is totally different. It's an autoimmune disease where your own body attacks the joint lining. This causes massive inflammation, and you often see a knock-knee shape develop. And of course, we can't talk about knee problems without mentioning meniscus tears. You have two of these C-shaped shock absorbers in your knee. The one on the inside, the medial one, gets torn way more often. But why? Well, it's all about mobility. It's really tied down to other structures in the knee, so when there's a sudden twist, it can't get out of the way and rip. Okay, so after all that talk of what can go wrong, here's the good news. A huge, huge number of knee problems can get better without ever needing surgery. So let's check out that conservative path to getting back on your feet. See, a good recovery plan isn't just a random list of exercises. It's a journey, and it happens in phases. You start with the protection phase, just calming everything down, controlling pain and swelling. Then you move into the controlled motion phase, where you start gently getting movement back and building some strength. And finally, you hit the return to function phase. This is all about getting your balance, your endurance, your life back. And the real secret to making all this work, it's about being an active participant. It's not just about the knee, it's about the entire system. That means strengthening the muscles at your hips and even your ankles. It means doing functional stuff that looks like real life. Stretching out what's tight, and keeping your fitness up with low-impact things like swimming or biking.
But of course, sometimes conservative care isn't enough. For those really severe cases where the pain just won't quit and you can barely move, well, that's when we have to talk about the surgical solution. So let's talk about the TKA, or total knee arthroplasty. Everyone calls it a knee replacement, but honestly, that's a bit of a misnomer. A better way to think about it is resurfacing. The surgeon isn't yanking out your whole joint. They're just shaving off the damaged arthritic surfaces and capping them with smooth, new metal and plastic parts. Getting the surgery is only half the battle. The rehab that comes after is absolutely critical, and it follows a pretty clear timeline. That first month is all about protection, getting pain under control, and just getting the knee to bend to 90 degrees. The next month, you're working toward getting your full weight on it and pushing that bend even further. And after 8 weeks or so, it's all about advanced training to get you back to doing what you love.
And the big takeaway here, this procedure is incredibly successful. For the right person, the results can be life-changing. We're talking about 90% of people getting major pain relief and having that new joint last them a good 15, 20 years, maybe even longer. It's pretty amazing.
So what a journey, right? We've gone from the knee's incredible engineering to how it breaks down and how we put it back together. But that just leaves one last big question. With everything that's happening in medicine, robotics, growing new cartilage, all these new biologics, what's this whole story going to look like in another 10 years? What will the knee of the future be capable of?